with over 55,000 views of our webinars so far. We're forging new partnerships, signing agreements with 12 other international academic societies, and building an enduring network we hope will last for many years to come. So, what can you expect from us? Free webinars led by key opinion leaders from around the world and across all fields of orthopedic surgery and traumatology, as well as chat shows with some of the most interesting and inspiring surgeons on the planet. Opportunities to take an interactive role in these webinars by participating in polls and live discussions. Free on-demand Pioneer playback service. Watch our webinars again and again in your own time. And coming soon, our new bespoke learning management system will host podcasts, an online version of the famous SICOT diploma exam, virtual training modules, surgical technique courses, a discussion forum, and much, much more. We hope you'll join us on this pioneering journey as we push the boundaries of what is possible in online orthopedic education together.
Good morning, good afternoon, and good evening, ladies and gentlemen. Welcome to the SICOT Pioneer webinar series. I'm Dr. Margaret from Hong Kong, the chair of the SICOT Education Academy. Before introducing today's chair and faculty, I would like to share some background on the SICOT Pioneer initiative. The SICOT Pioneer is part of the SICOT Education virtual platform, which launched in June 2020. Since its inception, we have organized 98 webinars and 7 tete-a-tete sessions. To date, the platform has garnered over 47,000 live views and over 82,000 on-demand views. We are also proud to have a pioneer fan club of just under 11,000 members. If you would like to explore our previous webinars and other education activities, please visit the SICOT website at www.sicot.org. We encourage you to join as a member to access these resources on demand. Today's webinar is co-organized by our SICOT Education Committee and Brazilian Society of Orthopaedics and Traumatology. It is on one of the recent heated topics on social media for orthopedic surgeons. Our moderators are Dr. Shyam from India, who is our SICOT Education Committee Chair, as well as Dr. Tatiana Guerschman from Brazil, who is the Vice Chair of our SICOT Orthopaedic Rehabilitation Committee. And without further ado, I'll now hand over to our moderators, Sassy and Tatiana, to begin the session. Thank you and enjoy.
Thank you, everyone. I'm Tatiana from Brazil. Good morning, good afternoon, and good evening to all of our friends and viewers. It's a pleasure and an honor to moderate this webinar with Saseendar. It's a very special event, as this is the first time that the SICOT Pioneer is combined with SBOT, the Brazilian Society of Orthopedics and Traumatology. SBOT is the largest orthopedic society in Latin America and one of the largest in the world. We have about 14,000 members working in all 5 regions of Brazil. So it's very nice to have this webinar. Our first presentation will be Why Social Media Matters for Orthopedic Surgeons by Dr. Saseendar. She's a consultant arthroscopy and sports surgeon from SRM Global Hospital in Chennai, India. She's a specialist in complex shoulder and knee surgeon. She's also vice chair of the SICOT Shoulder and Elbow Committee and member of the Educational Rehabilitation and Sports and Arthroscopy Committee. Please welcome Samu. Can you please share your screen with us? as I believe Samu is almost done, so I'll just give a short introduction about our faculties. So we have Dr. Samu from India, and then we have Dr. Badia. He's a hand surgeon from Miami, Florida, in the USA. Then our next presentation will be by Dr. Martella Rodrigues. She's also a hand surgeon from Brazil. And then we have Dr. Nikolai Karpinski from St. Petersburg in Russia. And following, we have Dr. Temilolu Olufemi from Nigeria. And then Dr. Fernanda Rocha from São José dos Campos, Brazil. And the final talk will be by Dr. Camila de Matos. She's in Skånes University Hospital in Sweden. So I believe that now Samu is ready. If she's not, then we can move forward to the second presentation. Samu? Yeah. Can we just go ahead to your presentation, Dr. Badia, please? Dr. Badia will talk about building digital reputation, tips to stand out online. He's, as I said, he's a hand and upper limb orthopedic surgeon at the Badia Hand to Shoulder Center in Miami, and founder of the Ortho Now Orthopedic Walk-in Center.
Thank you.
Thank you.
Okay. Thank you for the invitation. You see my screen well, I assume?
Yes, perfect.
Perfect. Okay, so I will. I'm going to be giving a bit of a broader introduction, and basically how to stand out online, which I believe is many different components. Here's my disclosures. I'm involved in several different clinical activities and of course a few industry activities. So the point is that I think you have to have a very broad approach. Social media is only one component. Of course, today we're gonna focus on that. But I think it's important that the website is really, to me, your brand, and allows you to put what your clinical interests are, so that patients and colleagues can see that. Being involved in online journals, and then now there's so many chat groups. I belong probably to too many of these, but when I can find time, I always can learn something and occasionally contribute. And then there's specific groups, for example, SOME Docs, which stands for Social Media Docs. I encourage you to look at this. And we don't, as far as I know, we don't have too many international members, or they're based in the sort of New York area, but I'm involved in that. And then there's even patient groups online. And then one of the things that I've been doing now, many of my colleagues know, for the last 3 or 4 years, is live surgery. So if you go to hashtag Live Surgery Tuesday, I'm doing a case, and then there's actually interaction with the colleagues live. So that is a really interesting activity. Traditional media, I was going to put a Monty Python video here, not quite dead yet, but I think that's important too, that there is traditional media. So here, some of the countries represented. This was an article about one of the best gymnasts from Brazil, when she had to capitate ABN, and I collaborated with colleagues from Rio, and then I had done work with Sania Mirza from India. So it's really a very international effort. So it's not just online, but there is really traditional media. And the goal of, particularly of social media engagement, is to me, mostly education. Yes, people use it, socially, and it's fun, but as physicians, this is a rare opportunity, because the traditional media really cares more when it's somebody that is sort of a celebrity, right? You saw those 2 athletes, but I've been, for 30 years, I've been telling the media carpal tunnel syndrome is not from typing, right? But everyone thinks this. And the problem is, you cannot explain to them that it's a metabolic and hormonal phenomenon with nerve compression. They don't care. So at least with social media, you can do this. Yes, you can use it occasionally. I mean, I acquire some patients from that. More savvy patients can find all of us. for our particular area of interest. So if you're into brachial plexus, they're gonna find the people around the world who are doing plexus, which certainly would not be me. So it really all depends. And of course, the professional friendships is something unique. I wouldn't have met any of you if it wasn't for this. So in the end, I think that in-person exchanges, so these are colleagues happen to be in Miami coming through for the academy, and we spent the day together in the OR. So these are great opportunities. So I think that social media allows us to ultimately reach a personal interactions, which I'm hoping the future generations don't lose. We are able to use technology to also transmit surgery live. So this was EarCAD in Strasbourg. Ricardo Lucchetti there is narrating the thumb CMC arthroscopy I'm doing. So there's now we can use this technology to even go through social media to do this. As I mentioned, because my live surgery Tuesday really goes through Instagram. So how do you garner interest? Well, these are the things that you see on social media, right? Right? I mean, this is really what gets people's interest. They're not interested in, carpal instability. So you have to try to make it interesting, I think, for people, because there are people who suffer, say from a lunotriquetral injury, and maybe they can learn something about this. So ultimately, it is a way to just attract people. So why do I use it in particular? Well, in my case, I wear two main hats. One is I'm in private practice solo until recently, which means I did not have a big institution, a big hospital that would attract patients. I literally had to do it myself because I'm by myself, and my surgery center is down the hall. Today I'm in my New York City location, which I come every 6 weeks, but I'm mostly focused in Miami. And being in Miami, it's very focused on patients from the Caribbean, Central America, that maybe doesn't have as much access to a hand surgeon, or somebody, for example, interested in arthroscopy. So for me, this really helps. And then Tatiana mentioned about Ortho Now, which I'm very proud. I think today or tomorrow, finally, the transaction is going through. I'm finally selling it because I'm too busy to grow it, and it's not my expertise. But I had this vision. So you can, with social media, bring forward your vision, including, I'll mention later, I'm the author of a book where I talk about the challenges that all of us face in delivering healthcare. And we all know that many of these challenges involve private insurance companies, which stand in the way between us and our patients. And I'm very upfront talking about it. I have a podcast, although it's not been very active because, unfortunately, some lack of engagement. So maybe I just need to do a better job. So the advantage is obviously very accessible. You can have multiple formats, and you can share it. And once that happens, it may go viral, which is not usual, but sometimes it happens and it's free, right? The disadvantage is this, and we know there's now with AI, there's going to be increasing problems. I know I have a lot of, for example, impersonators, people who reach out to people and try to get money from them. So you have to be very careful with this. There are many platforms, and some of these will be discussed in more detail with my colleagues, but I'm going to go very quickly through some of these, the advantages. You can use these platforms in many different areas of your sphere. So I'm also a founder of a cadaver teaching lab at the Mark Institute in Miami. So we use that as well. And I mentioned healthcare advocacy. All right. So these are just some examples. So different components: my private practice, our surgery center, the urgent care center. So Facebook is really still wonderful because I think more of our patients are going to come from here. They tend to be older people. This is really the first big platform, and you can do ads. And so, and it's not very expensive. So these are just examples. In the middle, my AO fellowship with Klaus Lofka in Germany. So, I had dinner with him, and I'm able to post and talk about this. Twitter is very brief. I'm not very strong in Twitter. I find it's a little bit aggressive, so you have to be careful. People get really fired up, including our controversial president. So you have to be careful with Twitter. But I do occasionally go on there, and sometimes I can post a link to an article, for example, on cycling injuries. And then YouTube, of course, is really like the ViewMedi. But be careful, because if you post something with open surgery, they tend to censor a lot. So if you're trying to put PowerPoint lectures together with videos, I suggest you go Vimeo, and Vimeo is another platform, not as big, but you can host your videos there. But still, it's very interesting. I mean, I have about 10,000 followers now. This is an old one, but patients do ask questions there. Okay, and you can post. This is a former world #1 tennis player, and you can have a discussion. So Instagram is what I tend to use most. I don't have time to devote to too many different platforms, so this is the one I use the most. But it's nice because I do a lot of sports related injuries, and this is where a lot of athletes really go. So it's very good for sport and fitness circles. And the only thing is a little bit difficult sometimes to share things, in my opinion. So here's just some examples. In the middle is one of the past president, American Medical Association, spent the day with me, happens to be an orthopedic hand surgeon. So these are great opportunities. And then once in a while, you can put something with your family. My kids are now teenagers, but this is an old one because my daughter would kill me if I post something now. She's 18. But when people like, I think, to see that you have a personal life to some degree. So you have to decide how much you want to share that. Or having fun, drinking too much beer and skiing on St. Patrick's Day in Colorado. So LinkedIn is really the most professional one. This is really where you can post articles, and I've even found people to work with, whether it be employees or consultants. It's wonderful, and so I think LinkedIn is really excellent. And you can put a featured article, something you're very interested in. You click and you put featured, and it means it'll always stay there. And usually I do kind of a broad topic like outpatient joint replacements or something of that nature. Okay. TikTok, the fastest growing one, right? It's been a lot of controversy lately. What's going to happen in the U.S. with TikTok, but there's been such an outcry from people about maintaining it. So I think it's here to stay. The very short videos, the average engagement I've noted on anything I've posted is between 5 and 10 seconds. So you really have about 5 seconds to present an interesting topic for people, because everyone has very short attention spans. And of course, my first one was with my kids doing a dance. It's ridiculous, but that is how it started. And now we're doing surgery on TikTok, right? So this is interesting because I didn't put the link on it, but this is the only thing I've had that went viral. It was me complaining about a patient who had an amputation, and the insurance wanted an approval, of course, before I did an island flap. Absurd, and and the patients really grabbed onto that. So live surgery I mentioned. So here's a case of advanced glenohumeral arthritis. I present the case the day before. Then the morning of the case, I give an estimation as to what time it will go. And then patients, and I've had very few American colleagues, if any. It's kind of amazing to me, be honest, but I think there are reasons for that in terms of what's happening in U.S. healthcare. But it's mostly been international colleagues, and it's great because sometimes they present an interesting idea, then I modify it during surgery. So, and I think educating young people is important. So sometimes I transmit live surgery to a local high school, kids who are interested in healthcare, and they can ask questions. I think it's very rewarding. So you see here that one of the very rare times a local newspaper covered anything related to what we're doing, but they were interested in this. So they got to see a shoulder arthroscopy with me. Okay, so it requires time. As I mentioned before, it can be free. There are things you may spend a little money on, but it does require some time. And I recommend that you always direct patients back to your website, because that's the one place where you can interact with them. I don't like to answer clinical questions on social media. Some of you will talk about this later, I'm sure, but I think it's best not to do that and not to practice medicine, in the web. But enjoy this shift, because this is a great opportunity, a rare opportunity for us to finally educate people who don't know about carpal instability. Change is constant, right? We know there's going to be, these are newer platforms, but we're going to see more in the future. Be careful. This is in Bahia with a colleague from São Paulo. Some of you may know, but there are things you do not want to put on social media. I think everyone knows that. So I share it with you, but you want to be we hold a certain role in society, so you want to be careful about that. I don't use these QR codes enough, so I need to do more, but I'm sharing with you. So this goes to my website where patients can ask something directly, and I make an effort to answer. My social media, I believe this goes to my Instagram. So I hope that all of us can start following each other, because we're all obviously a little forward thinking in this, maybe compared to our colleagues. So I think we have to help each other grow. I mentioned before, this is my book. I talk about this is I have 26 contributors, including from Europe and South America, but we're all facing the same problems. I think particularly in private healthcare, we're facing real problems with insurance companies. So this is a book that I wrote in 10 weeks during the pandemic, and I basically talk about a lot of things that we face. And I mentioned social media in there in the chapter on opportunists in healthcare, because there are opportunists in social media that talk about things that they really don't know a lot about, and the patients don't know to distinguish whether they're experts in hand and wrist or knee like we are or not. So thank you for your attention, and I hope that we can all continue learning from each other.
Thank you so much, Dr. Badia. Very interesting and great presentation. Thank you.
Thank you.
We are leaving the questions for the end, as we are hurried with the time. So I'll just ask Samu to do her presentation. Please, Samu, can you share your screen?
Screen
Thank
is,
you.
yeah. Good day, everyone, for listeners and speakers and peers who are staying along with me. Every day we wake up today, and immediately what we do is we pick up the phone and see what is happening around, open the Instagram or Facebook or an email. I think it has become vital. It is playing a vital role in each and every one of the life. So how, as an orthopedic surgeon, we can understand that we can influence our people and society through the various platforms available. Myself, Dr. Saseendar, I work as consultant arthroscopic surgeon in the SRM Global Hospitals. We can see how the various digital platforms has evolved over the following 3 decades. It has been evolving with various diversified platforms having its own unique features and trends, which when we use efficiently can be a source of good communication towards the public and colleagues. We should focus on building the trust and improving the visibility and influence using these various digital platforms. We can see a rapid shift of digitalization happening among orthopedic surgeons. We see the literature shows more than 70% of patients come to consultation, look for the social media or any other platform available before they really come for us. Even the peers, etc., everybody comes to us along with scrolling down our various platforms such as LinkedIn, Instagram, or Twitter. So being absent online is like something locking your own clinic away from the world. Digital is the new waiting room. It's what we need to understand. So understand whether we are present where our patients are spending most of the time, because most people use this social media as their first touchstone point before they come and see you. With academics and other aspects, it shows around 65% of surgeons follow the medical contents and creators. Around 50% of the CME courses and global conferences are discovered via social media. And hospitals and academic institution itself encourage the surgeons to promote various contents on the social media platforms. In orthopedics, it can be from arthroplasty to pediatric orthopedics. Your subspecialty will not limit your work on digital impact. You can use all these digital medias to attract referrals, shape your reputation, and influence the public health in a better way. For your career, yes, it helps you to build your reputation. It builds trust among your peers and patients, improve your referrals internationally as well as nationally, improve your recognition, which can help you to become speaking invites, to promote your fellowship programs, and to improve your KOL status. In terms of relationship, it will open new paths to network with allied industries, researchers, mentors, improve revenue generation in outpatients and through the digital branding and collaborations. So today, the social media presence is your digital operating table. It may be anyone, your patients, your peers, or your collaborators. Everybody look for you, your online presence, before they really come and meet you. These are few real orthopedic examples. Surgeon A, spine, who has gained more than 10K followers by posting post-op recovery tips. There's a Surgeon B who have been invited to a FIFA Medical Congress after his Twitter tweets about his real work in sports. And Surgeon C, who's a foot and ankle surgeon, has published a journal after a viral case thread which he has done. Understand global platforms opens more global pathways. Your patients always look in the web, such as Insta, YouTube, or Google, to understand about their health issues. Look through the testimonials, the reels, and Google reviews of your own presence so that they will be able to go for a doctor who's approachable and knowledgeable. So, as a surgeons, how we can optimize the use of social media effectively? We can become an educators, as my other colleagues showed, prepare reels about the joint pains tips. You can showcase your expertise by providing your case highlights, your research talks. Some surgeons are becoming Instagram influencers or other media influencers in terms of injury preventions, rehab motivators. You can influence the market and help to promote your clinics, your practice, and share Google link reviews. Don't just use these platforms only to scroll, but rather use it to build your practice. The three platforms which every orthopedic surgeon should use should be LinkedIn, especially to collaborate with your peers and improve on your academic growth, keep your presence more visible, and improve your global network. Instagram is being more visible nowadays for your clinical practice, and Google Business is a direct generation of sources in your local and area of practice. You can pick one to start, be consistent with your post and reels, and you don't need to go viral actually, but you really have to show up. Stay consistent. Future trends and innovations. This can be integrated with telemedicine, which will enhance communication and thereby enhancing improved patient care. And artificial intelligence and analytics will provide us the various strategies for better user engagement and to improve the treatment and patient care needs. Stay updated with the trends and regulations. As we saw the chart in the first slide, it is dynamic and it's evolving and keep evolving with new ingredients. Understand the local regulatory compliance in your place. If you are a global influencer, understand the regional and global regulatory compliance. Thereby, you can use these as an effective mode of communication. There are certain setbacks and drawbacks as well in terms of patient behavior, ratings. Hence, it is very important to adhere to the professionalism which you are having offline. Same is the content which you have to present online. Thereby, you can avoid the trust erosions and misinformation risk. Hence, the key takeaways include your patients are not scrolling, your peers are also posting, your ideas to deserve a platform. So when you want to have more impact in terms of your clinic, outpatients, or research or public health advocacy, this social media is now becoming a low-cost and high-trust tool. Don't just operate as a surgeon, you can also educate. Don't just scroll, but you can lead. Let's represent orthopedics the right way, globally, responsibly, and visibly. Thank you, one and all.
Thank you so much, Samu. Very good. Thank you. So we'll leave the questions to the end as we're a bit tight in the time. So I'm calling our third presentation, Choosing the Right Platform by Dr. Martella Rodrigues. Marcela is a hand surgeon. She's the founder of the Ortho Academy. She's part of the AMOB, the Brazilian Women in Orthopedics Association board, and she is also a member of SBOT. Please, Marcela, can you share your screen?
Thank you for the invitation. It's a pleasure to be here in the morning with you. I guess my presentation is already on your screen, right?
Yes, it is. Perfect. Thank you.
Okay. How to choose the right platform, because we have just seen in the first presentation that we have many options. First of all, we have to remember that people spend more than 3 hours a day on the social media, so we might be there. Social media platforms have 2 billion, more than that, users. And more than 80% of patients search online. We have already some articles that shows that. My experience is that I started in 2019 with simple information, weekly classes, free and open content. And in the next year, 2020, I already started my course, Orthopaedic and Hand Surgery online course. And now, 2025, we hit the 500 orthopedic students in the Ortho Academy. So the power of social media for not only patients, but also for the education. And this is my Instagram, first in 2019 and now 2025 with more than 90.6 users and followers. And how to choose the right platform. First of all, we have to define your objective and the desired audience, because the communication is different for one and for others. And we have to adapt the content. Each platform requires different information in different formats. This is the key of the presentation. So if you want to print, to photograph this, we have Facebook, we have YouTube, WhatsApp, Instagram, TikTok, and LinkedIn. The YouTube, we usually use long form videos. It's more for educative. It's important for patients, but also for students. WhatsApp we use for communicating with patients and also with our students. And Instagram is visual content, is smart videos, creative videos, short videos. So we use this for connecting with our audience. TikTok is more for younger demographics. We know that in some years it probably been the biggest platform. So we have to be attentive for that. And LinkedIn is more for professional network and academic networking. What I suggest is for student education to use YouTube and Instagram. And here we can use medical language, and it's suggestive to show case studies because they love that. For visibility and patient acquisition, the best is Instagram and TikTok. And here you need to keep your language more accessible, and you cannot use medical language as you use when you're communicating with students. And here is important to show medical office. You wearing your coat, talking with other patients, these attract attention for your patients. And for scientific networking, LinkedIn is the best, and here you can show articles. My choice nowadays is to use YouTube and Instagram. YouTube for teaching and Instagram for connecting. So these are the two big choice for us here in our school, that is Ortho Academy. And 3 tips for all of platforms is to respect medical counsel, respect ethical guidelines, to use more information that brings education. Educational posts tend to be tend to be better than promotion content. We have already some articles showing that. So we tend to prefer educational posts if you are talking with patients or if you are talking to students. And the third tips is constancy. Usain Bolt, I guess all of you know him. He trained 4 years to run 9 seconds, and people give up when they don't see results in 2 months. So keep what you are doing, that you will see the results. Thank you all. If you want to find me, I'm on the Instagram as Marcela Orthopeedista. Thank you.
Thank you, Marcela. Very interesting, very good. We know about your course, the Ortho Academy, and it reaches so many people. So, following, our next presentation will be about social media pitfalls by Dr. Nikolai Karpinski. Dr. Nikolai is also a hand surgeon from St. Petersburg in Russia. Could please share your screen, Dr. Nikolai? Thank you. We can all see.
Is it
Perfect.
fine? Yeah, you see
Yes.
me? Well, yeah, this is me, this is Karpinski, and my topic for today is the pitfalls in social media. And first we can start with the definition, and a pitfall is a hidden or unsuspected danger or difficulty. And you see, this is, I don't know why, one of the most popular pictures that Google shows for pitfall. And as you can see, the man is in a white coat. So probably we're all a bit of in danger, and even the Google says that the guys in white coats are in danger. Actually, this is how the real pitfall looks in my country, and it might be dangerous. There's about 30,000 criminal cases in Russia for the last 15 years that were started due to some actions in social media, comments, posts, or something like this. And this is not actually the pitfall where you want to be. So first of all, in here, the most dangerous things that you can do in social media is to write something political or kind of the real social, like that is not the topic we are discussing by now. In more safer places, you can caught accidentally cold plate. I hope you know this accident. And this is how I want to point out that the personal data is one of the most secure data that should not be shared. And this, we are dealing with the patients. We always say that none of the details that can lead to patient identification, whether it will be face or some scars or tattoos or anything that can be related and connected with the patient, should be shown up without the consent, like when the patient is not agreed. So you can show the patient's interviews, but you should be sure that is the loyal one, and well, he agrees to be shown to the world. And sharing personal data, I suppose, is one of the most harmful consequences that can be done in social media. So try to know the laws of the area where you're working, and well, follow them. So this is the most important thing. And as we're going to pitfalls, I would like to share you 2 cases of like a bit stressful situations that happened to me in social media. This is my wonderful colleagues from all around Europe. I work in communication committee of Federation of European Societies for Surgery of the Hand, and we represent FASH in social media, and we think about the content plan and what we're going to present for hand surgeons around Europe and around the globe. These are very nice people. And one of our activities is to advertise the monthly webinars that are held by the Federation. So each month we have a webinar with the National Society. So one with the Switzerland, one with the UK, and then following the Spain. And well, this is like a regular event. Nothing is going to happen. Well, this is a safe place. And the first pitfall we have got in February 2025 is when we announced one of the next webinar with the Israeli Society. So we have a marketing agency, and they just post that, well, there will be a monthly webinar with the member of FASH. And actually, this is a trigger. So by now, you can't show the Israeli flag. And we have a huge amount of the hate comments, like we're supporting the genocide and all the stuff like that. So the flood was really fast and emerging. So we decided to close the comments, to delete the post, and postpone this webinar to the next, I don't know, years. So we canceled this activity. And in fact, by now, several months after, it caused no impact for FASH. This is how I want to point that the point is that the negative comments, some emergencies that you can get from the comments and from reposting might be really sensitive at the moment, but it doesn't last long. So most of these waves are short-term things. And if you just maybe close the comments, you can delete the post and just stay calm for a week or 2 or 3, then the storm will be over. So mostly it's not the really thing that will be harmful for you in the long-term view. Yeah? The second one is my personal account. I was really tired and I just recorded an emotional video about the radiologist. You know, explaining the 5th time that degenerative changes in TFCC that is described in MRI is nothing to do. So, my point was that the orthopedic surgeons, they really don't read the description of the MRI or CT, and this is actually, that was a kind of a rude video. So I said that, well, the radiologists are useless describing the orthopedic images, and we don't read that, we only see the pictures, and well, the AI will replace the radiologist, and actually this is, that was my point. I've got a lot of hate comments from the radiologists. I've got a huge amount of support from Orthobro, and they say, whoa, you can do that. And the video was copied to the other platforms from Instagram, and there was a big discussions like really beyond the carpet that I don't know in fact. So what we got by the end, I've got one radiologist who called me and say, whoa, what are you doing? And I say, okay, come, we'll shoot the podcast for 1 hour and we'll discuss what do the radiologists where they are important, and what we can really find the help from the guys who read the images. And actually, this podcast was just about for 300 views, comparing to 30,000 of views of my emotional video. So it was not that interesting for the audience. And we agreed that there are things that they can help us, and where they are really helpless, and what the AI do. And well, in fact, I got some invitations to the panel discussions of the AI in medicine. I just had some new connections in the medical societies, and the only thing that the chief physician of my clinic just said, well, when you're provocative, please don't use the clinic identity. Just stay like an independent person. Do not represent the institution where you work. So in fact, I've got more followers. I've got invitation to comment and to participate in the panel discussions. So what are my advices for the social media users? Don't be afraid, and you have to avoid it, like politics and religion, and this are kind of sensitive topics. But actually, we are orthopedic surgeons, hand surgeons, so this is not the things that we are going to discuss. Social media storms might be rough at the moment, but they are short. So just calm down, breathe out, wait a little, and this will calm in the time. And whenever you stay in your professional field of the competence, actually, I suppose you're safe. If you are talking to the things where you are professional, that you know that this is right, so you are fine, because you're good at that. Yeah, that's it. Well, my Insta is downstairs. Karpinski hand.
Thank you, Karpinski. Very interesting to see how maybe not good things can turn out to good things and everything. So, yeah, thank you so much. We'll leave the questions to the end. So, following, we are calling Dr. Temilolu Olufemi. She's talking about leveraging social media for patients and education. Temi is a consultant orthoplastic and trauma surgeon at the National Orthopaedic Hospital Ignobi Lagos, Nigeria. She's also the chair of the SICO website committee and chair of the Gender and Diversity Task Force. Thank you, Temi. Please go ahead. We can see your screen, but we cannot hear you.
Can you hear me now?
Now, yes. Perfect.
All right. Good morning, good afternoon, good evening, everyone. It's always a delight to share knowledge. Thanks, Tatiana, for this invite. We're going to be talking about leveraging social media for patient education. And at the end of this talk, we'll be able to understand better the impact of social media in patient education, and also understand the opportunities for leverage in patient education. We've had a lot of talk about social media and why it's important in health. Samu started off by saying most of us, when we wake up, we just pick up our phones and then see what is happening in the world. That's because over 5 billion people have access to the internet globally. And more than 50% of these people are actually active on social media. So you have real-time reach, there's low cost of communication. Alejandro had mentioned earlier that it was free. Yes, you're paying for internet service, but it's largely free to an extent. And there is an opportunity for community engagement. Health information is so rampant, and it gives us an opportunity to empower. Over the years, there have been different evolutions for social media platforms. And currently, as shared by Marcella in her slides, Facebook tops the chart with over 3 billion users, active users on Facebook. YouTube, Instagram, Twitter, and LinkedIn. Now, TikTok is on the rise as well, with about 1 billion people using TikTok daily. It's also important to understand the niche, all right, of people that we want to reach out to. So depending on what you want to communicate, that would influence the platform that you're going to use. So this infographic actually helps us to understand it better. While YouTube will have videos that will show you the exact occurrence, LinkedIn will tell you that, yes, I'm very good at this particular task. And then Twitter will just say, oh, Twitter is just short, straight to the point, like, I need to do this. So different platforms, different people, but all with the same focus. If we're going to be educating patients, then we need to understand which platform works best for the individuals. Like has been mentioned before, Facebook, even though it's the largest platform, is more akin to older demographics. So if you're into visual storytelling and short reels, we're talking TikTok, Instagram. If it's animation and infographics, then we're thinking about reels with WhatsApp as well and Instagram. And then on X, for active youths, fast updates, micro-learning, that's just the way to go. A lot of work also has been done on patient education and social media across the years. And I just tried to showcase these 4 studies from across the world, from Germany, from the States, and also from Israel. Most of the time, for this particular study in 2023, an internet by Genter et al. Shows that most people who would come to clinic to see you have already Googled their symptoms online. It shows websites, clinic websites, and Google use as the preferred social media platform for patients who are seeking for some form of education. But for a larger crowd, Instagram, LinkedIn, and YouTube have gained ground. It also is important to note that social media helps to address a patient education gap. There is a gap. Back in the day, we would have posters, flyers, in-person talks, traditional models. And as Alejandro mentioned, it's not as if we're doing away with them. They still have a place, but the world has moved a little beyond that, and we need to move with the times. Patients will seek information before consulting you, and there is a lot of misinformation out there. So the onus is on us as orthopedic surgeons to put out correct, validated information to our patients to help them. It's quite scalable. The reason being, you can put out a post and then it just goes, well, it might not necessarily go viral, but it can reach like 1 million people in that instance. It is accessible, as we have mentioned earlier, and it's real time. Hence, it helps you to save time. You're able to engage with people through interactive sessions, polls, questions and answers, and you can build a community of trust from people who reach out to you and who you're able to give feedback to. Now, based on this patient education gap, there is an online movement of people who actually have an e-community, who are just patients seeking out help online and being led through different sources. Most of us would have read about e-patient Dave, who was actively involved in his management when he was diagnosed with stage 4 kidney cancer in 2027. And with that, a lot of e-patient platforms have gained traction. What are the modalities that we can use for leverage? We have the knowledge as orthopedic surgeons. And we need to be able to put it out there in simple terms, simplify things for people to understand. It's not every time that we have to use medical terminologies. We come down to the levels, make it simple and short for them to be able to understand. You can use reels and short videos, demonstration videos like Alejandro mentioned earlier as well. Patient testimonials are fantastic. You have a patient who's done a total hip replacement, you have a video before and after for them walking, or a patient actually just talking about their experience. That goes a long way in educating another patient who has similar pathologies and is seeking help. You can have live sessions, interactive question and answer sessions, and animation also can help to captivate your audience when you're putting out this information on platforms. Another avenue for leverage would be the use of local languages and culturally relevant content. Now, most people speak English around the world, but if you're local, for instance, now, if Tatiana was going to be active on social media and most of the people in Brazil speak Portuguese, you're going to be losing a very large audience if your information is being passed across in English. So use local languages. In Nigeria, we have what we call pidgin English, and we have a doctor who is quite active on social media. We call him Aproko Doctor. If you're not speaking English, you have it's like mid-level, funkified, colloquial English that everybody understands and is able to break down the very simplest of symptoms with a very large audience and followership. There are lots of challenges on social media now. Everybody is doing a dance to something and then is gaining traction. Everyone on TikTok jumps on it. Why can't we have orthopedic related wellness challenges? See how easy it is for you to get up from the floor, or how long you can do a one-legged stance, things like that. It helps to gain traction, help people to understand, okay, this is how I will do this if I was an orthopedic patient. Engagement is quite important. You're not lecturing people. You are coming down to the level, keeping things nice and simple. Hashtags have quite a lot of views and it draws followers. So if you have the appropriate hashtags and you use them on your post, it helps to create more engagement as well. Marcella and Samu emphasized the fact that you had to be consistent. Consistency is key. You can upload a post and it doesn't gain any traction. And then 3 months down the line, someone stumbles on it, reposts it, and then you build a community just from that. So consistency and credibility are quite important. Even in your local neighborhoods, you have a function in your neighborhood. There is an opportunity to give like a health talk. We can use that modality as a way to talk about things that are related to orthopedics, and it's put on platforms like neighborhood platforms, WhatsApp, or it could even be an Instagram page, or even at congresses. We have the SICOT Congress coming up in September, and things that are happening at the congresses are being uploaded on social media every day. So that's an opportunity as well to leverage patient education. You also can use influencers and health advocates, people who are well-known, familiar faces, to able to interpret orthopedic context and reach a larger number of people. Some of the pitfalls that could occur will be misinformation. So people say a lot of things that are not true. Someone can say, well, if you lie down in a particular way for too long, it causes leg pain or back pain. And we all know that might not really be true. And it's an opportunity to debunk myths, medical myths that are a lot of them are out there. A lot of people too can be quite scared about the fact that social media is putting yourself out there. You're a very shy individual, but you can put positive frames out when you're posting on social media. Always bear in mind that if you're posting videos or you're showing live surgeries, Bear in mind that compliance is well maintained, so privacy violations should be well considered, and ethical codes disclaimers should always be put out. Once you start this journey, initially, try as much as possible to track your reach. I put up a post on LinkedIn about 3 weeks ago, and it's impressive, over like 4,000 impressions. I didn't even expect that. Lots of views, but the impressions were the ones that just blew my mind, essentially. And make sure you engage. It's not just putting up a post and then going silent. You will have to engage the followership, likes, shares, respond to comments. If you get quite good at it, you can set up polls and feedbacks. And then in the long term, you see how this affects a behavioral change in your clinics and screening methods. One might wonder, if you're starting out the journey, if it will work. There are proven examples that show that social media use for patient education is fantastic. The Mayo Clinic on TikTok started engaging teens on mental health and hygiene. In Nigeria, the UNFPA gave out, there was a hashtag safe birth in Nigeria across all platforms, and it helps to reduce the myths about maternal health with a reduction in maternal mortality rates. India's Ministry of Health on YouTube went ahead to roll out a lot of information on vaccination drives, and in Kenya, Kenya's Ask a Doctor on WhatsApp helped to target frequently asked questions in rural areas. Now for orthopedics, you'd wonder, how do you leverage, who should you be following? How do you go about putting out this information to educate patients? And this article by Varadi et al. In 2019 shows that out of about 100 active influencers on social media, only about 73 of them were actually core orthopedic surgeons. And of these 73%, a larger proportion of them were from private practice. So those of us in academia are not really doing a lot by showcasing the things that we do. Most people were in sports medicine. I'm an arthroplasty surgeon, and the numbers are even less than 5%. And you wonder, there's so many arthroplasty societies in Nigeria, there is in ACAS, there is in Europe. Why aren't we pushing out a lot more information out there for our patients? So there is a lot more work that can be done. This caught my eye when I was preparing for this webinar. It was recorded in the 2023 AOS meeting, and Corey Callendan is in charge of media for the AOS. It's actually a very insightful podcast, and I would recommend that we go ahead and listen to it, highlighting your preferred approach, how you shouldn't get overwhelmed, start easy but stay consistent, build a followership, and then grow from there. He went ahead to say that there were some of his patients, he helped to diversify his private practice, and a lot of the patients who were coming to see him in private practice were actually people who had either checked on his videos or learned something he had posted online. So there is a lot that can be done. That to educate patients and to avoid being overwhelmed, just start easy. You can do 1 or 2 posts per week. It can even be 2 posts per month, but start gradually and be consistent. Try as much as possible to use plain language, avoid jargons, and you can mix educational and personal behind the scenes techniques that will help you to captivate and engage the audience, keep them glued, help them to learn, and move on as well. The most important thing, however, will be that you should define your audience. Are you looking at patients who require hip or knee replacements? Are you looking at athletes in sports medicine? Are you focused on pediatrics or older adults? Carve a niche for yourself and build from there. There are tools that make things easy, nice, and fancy. A lot of them are free. They're available online. and it just makes working on your posts much easier. So you can have a weekly plan. You can start with something simple. Everybody, well, I'm sure we've all heard it at some point in time, that if you crack your knuckles, does it cause arthritis? You can just put out a post there and say, oh, okay, this is what actually happens when you crack your knuckles. You can focus on sometime midweek and then say, oh, okay, this is going to be more surgical education. And then just a snippet of what happens with meniscal surgeries. And then on another day, pick something that has to do with behind the scenes in real life, either clinic or surgery. So what are we taking home? The world is a global village. Social media is here to stay. And we need to embrace social media as a core part of our patient education strategy. It's not going to change. So we need to get on that, on the train and then just move with the times. You need to spend time investing in communication and digital literacy and leverage on the use of local content, local languages, and engagement. Engagement is important. Don't leave your listeners or your followers. If they need feedback from you, just give them. I'm not saying go to town and start explaining things that are all medical. Keep it simple and short. Get them, whet their appetite, get them enough to come to the hospital to seek clarity and focused care. We need to empower our health workers to become digital educators. Everybody has a phone. Everybody, we're all here, we're at this webinar, the people who are watching online. The time that you have spent here is enough time to be able to put out some information to someone who needs it somewhere. And our patients are already online. Half of the 5 billion people are online. 50% of them are on social media. So why don't we just meet them there? Let's meet our patients online and let's continue educating them. Thank you very much.
Thank you so much, Temi. Very, very good, very interesting. I think it will help a lot of us to leverage social media and to help it in patients' education and everything. Thank you. Thank you. So moving forward, we are calling Fernanda Rocha from Brazil. She's also a hand surgeon. And she's part of the AMOB board. She's actually now practicing at the Ortho Service Hospital in São José dos Campos, Brazil. And she's talking about navigating medical legal risk. So please, Fernanda, if you could share your screen.
Hello, everyone. Tati, I have a problem with my share screen.
What is happening? Maybe Sofian can present. Did you send it?
I have to. Could you start with Camila before?
Yes, okay. So Camila, yes. I think she's ready. Yes. Okay, so Camila is oncology orthopedic surgeon. She's the founder of AMOB and WO, which is Women in Orthopedics Worldwide. She's practicing now in Skånes University Hospital in Sweden, and she will talk about pitfalls, how to do well without social media, and the dark side of addiction to social media. So Camila, go ahead. Thank you.
Thank you so much for inviting me to talk about this. When Tatiana reached out and asked me if I wanted to present, I was like, Tati, I don't do social media. I did social media, like Tati said, to both the Women in Orthopedics Worldwide and also to the Brazilian Association. So I have a bit of experience working both in private and public settings. I work here in Sweden for almost 7 years now. So it's a private setting in an academic hospital. And so I'm going to give my 2 cents on everything that you guys have been talking about. But I think of the dangers, some of the dangers that were not really discussed here. So you all mentioned how good social media can be helpful for communicating with patients, having professional networking, public education, academic engagement. What is the cost of this social media that we are doing? We know also, you all mentioned about patient education, and not just that, but medical education that we know already has been going a lot through social media and YouTube, TikTok, and other types of platforms, instead of just the old school regular classrooms and books. And we know that this type of education is changing. Of course, that's why it's old school now. All the research out there is showing that we're having shorter attention. We need faster contact. All of us are guilty of scrolling through our phones here during this presentation. Maybe we have a shorter attention spans, especially for the ones that are presenting latest on the webinars. and we know that. So the way that we teach and that we learn is changing. We need to follow that. And we know that social media is dominating this type of education platform as well. We know that now visual is a priority, visual with text and speed without a lot of depth. And we know that this has a cognitive impact. And we know that more screen time is more shallower focus and reduced memory. And we know that this type of changing in medical education, and also how our own habits are changing, is affecting us in a negative way. These are some of some studies within medical students that are showing that we are addicted to social media. Not just students, but residents, doctors. And this shows a neurocognitive decline from screen overuse. Smartphone use is linked to study time loss, and unfortunately is also affecting negatively with burnout. And none of you talked about this in your presentations. And you talk about why are we doing social media? Of course, engagement, but also we forget that there's a lot of the negative things that people do use social media. There's a lot of ego, hubris, and we need to show up, not just to get more patients and educate them, but also to get a sense of belonging, to improve our income, and also because we're addicted. Previously, we had a source of referrals that come from colleagues and other sources. I mean, some of you mentioned Google, but Google is not social media, so it's a search engine, and you can see the types of reviews that people left before, and these are still true and not connected to social media, and these are still ways that people can look for doctors. But now apparently visibility is really connected with value. I highly recommend, if you haven't read Naomi Klein's Doppelganger book, is very, very good. But we cannot talk about social media without talking about capitalism in medicine, as the doctor is a brand, is your own personal brand. In many of the private systems, if you don't have an online presence, you don't survive. So this personal brand sometimes can be replaced by your previous clinical reputation. So your work is so through this curated persona that you show up online. And colleagues sometimes can become competitors. This person have more followers than me. Why? We know that this person is not technically better than, we all know about that. And this becomes a topics of discussions and thoughts. And the ethics are being sometimes being substituted by marketing. And just a quick overview here on my practice in Sweden. It's not perfect, but as I said, I work in a public setting, so there's a little bit of rules. There's no clear rules because most of my colleagues have the idea of having a social media for your work is for them is completely insane. Some people that want to be influencers and want to be in the media educating people, they do have some platforms. There's some known people that talk in the radio and TV. They do have previously Twitter, and some of them have Instagram, but this is definitely not the norm. So no social media is expected from us. Most referrals come through the public health, and we don't. I was trying to explain to Fernanda that we know ourselves personally. We don't get you really don't choose who's the doctor that is seeing you in a public setting, but the people have a big trust in the institution. So if you got referred to this doctor for this problem, they trust that you have the knowledge and you are in your position because you are good in what you do. So there's a still trust in the institution, and this does not come from an algorithm. There's no pressure, no selling, no forced persona for that. Content creation, if you want to do here, there's some rules that you cannot do this during your work. You do it during your breaks. And if you put in the hospital or whatever you're working there, you need to have approval. So it's not very easy to do. This is very important to understand. As I see, being someone that worked both in Brazil, Sweden, and the US, I did 3 years of fellowships in the US, so I know how the system works as well and how it's expected for you to get patients. So there's the employer's expectations, the visible cost, the hidden personal cost, and the time invested required to do this social media. I have an anecdotal story from a personal friend of mine in São Paulo that works in a big hospital with one of the big chains. When they got their position, the marketing person gave them an Instagram account and first asked, do you have an Instagram? They said no. And they set up an account and say, well, there you go. You need to post it. You need to be online. You need to be visible. So some hospitals expect for you to have a social media, and these are created by marketing, but maintained by you as a doctor. There's no training, no protected time, no compensation. This is not something that is, if you have a contract, is it in your contract? Can you put it in your contract? Some of you ever had some social medias written in a contract? So you use that, all of you said, we wake up, we reach to our phones, and this is highly connected to what we do. If you have a very high presence in social media, the first thing you do when you check your phone, you're also working, and you do that during your break, your nights, your weekends, your time with your family. So there's no, it's unpaid labor in plain sight. The ethical boundaries of that, you all said a little bit about that, and I think Fernanda will also say a little bit more. But are we doctors? Are we influencers? What are we sharing online? Are we sharing patient information because they want? The patients that they want to get traction as well. So you're a very famous doctor. They want their stories to be shared. So you think it's okay, even though there's an ethical code before that you should follow, and why are you sharing that? Is because the person wants to share, you want engagement, you really want to teach. The lines are very blurred when I look into that. There's of course privacy concerns and boundary issues as well. This started, like, if you read articles, literature on social media from back, like for maybe 10 years, where Facebook were very more prevalent. Like, should you follow a friend request from a patient? And now this is like, maybe some of the social media influencers, they don't want to have a lot of people that they are following, but a large number of followers. So they follow very limited amount of people. So to show that this is the big difference, look how important I am. And this is, can doctor really be liked? This is very blurred for me. And this creates, as I said, a persona. Like, who are you online? Some of you mentioned this is my personal account, but your personal account is your work account. Are you really just the person that is working? Are you a doctor 24 hours a day? Is this who you are? So you share those, you blur those boundaries, you share your family, your hobbies, and for some people that's completely okay in your lifestyle. But why are we doing this? Are we doing this because we think it's nice? Are we going to get more engagement? This is some hard questions that I think some people really need to think, like, are we exposing our kids or our friends and our life? Why do we need to do that to work? Is this required right now? Is this the future that we want? Is this how if we continue to accept that, are we going to expect for everybody to do that? So engagement, we know that this engagement comes from relatability, not accuracy. So as the first speaker said, there's a lot of things that create engagement, and we know most of them are not people want to be said or taught some things. There's a lot of things that sells and engage really quicker. And this is not sustainable for everyone. And everything that we see online is bias. And then we are creating people that have a more difficult to really see those bias and try to be critical about the information that we are consuming. And yeah, the popularity over professionalism, we see also people that are selling more services and things, that doctors that are doing that through their social media. Is this ethical? What is this acceptable? So we're diluting medical advice, diluted for reach, follower accounts influencing, hiring people, and also the other way around, people choosing where they're doing their fellowships or their education because of the social media of the place, and also deciding influencing patients' decisions. And engagement, it's hard for us sometimes to remember that engagement is not the same thing as expertise. And there's a literature, of course, some of you showed some of them. But what the literature says, and it doesn't say about social media, and especially orthopedic surgeon, is, of course, we talk about the benefits, the personal risks, but the personal risk for you as a doctor, as your brand, the doctor, as a liability, your reputation, but they don't mention unpaid work, they don't mention burnout risk, there's no guidance about boundaries or labor ethics. So my take-home message is social media training should be mandatory if it's expected. I don't know if there's any country in the world that is have in their curriculum social media to doctors. I hope that they do, to have some ethics behind that. But also, communication should involve not just experts in communication. There's people that study that, not just clinicians. We're doing that without expertise, or sometimes we're paying for people that don't also have the expertise or the knowledge to do this in a correct way. This is unpaid digital labor. It steals time from our rest or leisure or mental health care. It adds to a list of unpaid work that we as doctors already do. We do peer review, we do diversity work as our free unpaid work, labor. It increases screen time, and this leads to burnout, and also it gets our memory and our attention span worse. It blurs the line between what is private and what is public. And as I said, medicine is a trust industry. It should not be a popularity contest, and the social media should be a choice, really. And if expected, for me, it should be paid, especially if you have an employer. And I understand that a lot of us work in the private setting, and we're expected to do this, but I really hope that we can do that in a more ethical way. So social media for doctors, for me, isn't neutral. It's labor, it's branding, it's a risk, and it's often not your choice. So you, as a private physician, you don't really have a choice. You need to reach out for patients, and this is the world that we live here, wanting or not. But we need to work towards to get education about this, but searching also our rights and rewards for our labor without selling or giving ourselves. And as I mentioned, I don't have any I have a private social media with my life and my political views and everything else that you shouldn't do as a doctor if you have a platform as a doctor. But I would like to share the Women in Orthopedics Worldwide Instagram account. Thank you very much.
Thank you so much, Camila. Perfect. Very, very good. I share a lot of points with you, but it's very interesting to see, I think, for everybody, as this is like a global webinar, and it's very good for us to see how it works in Sweden and maybe in India and everywhere. So very, very good. So Fernanda, are you ready? Can we share your screen? Can you share your screen?
Hello, Tati. My computer not share screen.
No. So Saseendar, do we have time for a few questions?
We can go ahead with the questions, and if Fernanda is able to send the PowerPoint to Sufyan, then Sufyan can share the screen and Fernanda can speak. In the meanwhile, we can take a couple of questions.
Okay, so we had some questions about how social media can be helpful for growth of your name and patient education. How do we deal with negative comments? Anyone want to answer this? Just shall we answer the negative comments or just ignore? What are your feelings about this? Yes, Nikolai.
Well, this is, I suppose, my topic. Mine was about the pitfalls. Well, actually, dealing with negative is a skill. So if you can answer that, if it's something constructive, and actually you can turn this negative into positive, and you can ban them as if it's nothing constructive and you cannot talk to that. You can ignore that. This will be your style. This will be how you deal with that. But first of all, you don't have to worry. And if you have negative comments, then it means that you are visible, that you have done something that matters. you can wait a little bit, and then you will have support in the other comment. So you've got one negative comment, and your followers may help you, and they will leave the positive comments, and they will interact with them, with those, and well, this is fine. So my advice is, if there is any seed of sense, you can follow the discussion. If there is not, you can delete, you can close the comments, you just can ban those who are leaving the bad comments. This is fine. According to the last talk, actually, the bad comments and negative comments will lead you to burnout. You can delete that. This is fine.
Yes, thank you, Nikolai. So I think that now Fernanda is ready for her presentation, navigating through medical legal risks.
Yeah.
So please, Fernanda, go ahead.
Sorry, now it's okay. I'm Fernanda. I'm so happy to be here. I love this discussion, these topics. I use the social media since 2014. So in 10 years, I saw the transformation, the physician using the social media. In 10 years, many things change. And in Brazil, we have a problem because the physician use the social media to be mediatic, to do things is not ethical. So nowadays have laws to do for these physicians stop do things no ethicals on the social medias. So I talk about the medical legal risks of the social media. You have to be careful because social media is a tool for education, visibility, and connection among physicians. But along with the benefits come global medical, legal, and ethical risks. What you post online can follow you across the borders and the court. I read some the legal risks around the world is different in each country. So I don't know about all other laws for the country, but the most laws have laws to protect and respect the laws for using the social media. In USA, the HIPAA protects patient privacy. In Europe, GDPR requires strict data consent. In Brazil, the CFM forbids promotion using any patient image. And so the common legal pitfalls the physician use to do a disciplinary action for posting photos that can identify patient cases is so you can't post photos with the face or the patient identified in this case. Commenting clinical case without consent is sharing misleading and unproven medical advice. Yeah. Which is these ethical concerns? The medical ethicals extend beyond the clinic into your post. Over promotion or exaggeration of results, specifically in dermatology, they put the aesthetic before and after. You put the face of the patient is not good. Blurring the line between person and professional. So I have two counts, one professional or the personal, because it's difficult between you post, you share your life. So in my media social, I just post the professional. A little bit of my kids. I have a son with Down syndrome, and so I expose this to help another family see how is a child with Down syndrome. So I think I do a good thing, but little bit. So I like to share more about the pathologies and the head surgery, and another thing is smoking patient, colleagues, and its institution. Each one's the reputation risks. A carries post damage more than your online image. May you lead the compliance to medical boards. It may affect institution reputation. A screenshot lasts forever, even delete posts. So careful with this. Now, each one's the best practice using on the media social. Always getting right in specific consent is very important. Use separated professional and personal accounts. Understand and follow local medical guidelines in your country. This is very important. You have to know the guidelines in your country to use the media social. Be careful with humor, opinions, and trends. Is so common that people do trends, dancing with the patient and the hospital. It's not a good. So some examples for official social medias in USA, UK, Brazil, and India. You know them, respect them, and teach them these global guidelines. Take home. Social media is powerful, but it's coming with responsibility. Stay ethical, stay legal, stay professional. What you post may go viral, but so can the consequence. Thank you for, sorry for my English, I'm so nervous. And this is my media social, follow me, and thank you for inviting.
Thank you, Fernanda. It was very good. No worries about your English. Most of us are not native speakers, so it's okay. We can understand. So, Saseendar, shall we go to questions now or closing?
Yes, we can have a few questions.
Mm-hmm. Will you ask the questions? Shall I ask?
I have logged the chat because I went out and came in. You please go ahead.
Okay. So, as Camila said, we don't like orthopedic surgeons. We don't have time. Most of us don't have time or even get paid for doing social media. Is it regular in your practice to pay someone to do the social media? To pay some marketing people or some office that are specialists in doing this? And how does it affect your practice? Is it good or not? Do patients agree with having with seeing something that was not personally done by you but by some office? What are your feelings for the doctors that use a lot of social media? I think that a few of them have left. Tell me, how do you feel about this? Do the doctors there in Nigeria just do the social media, or do they get someone to do it for them, like a marketing office or something like that?
So I think it's both ways. For people who don't have a very large followership, they have to take some time out to create the post and go ahead and upload on their own. And as Camila said, it's not like you're being paid extra for that, but it's just something you have to do to be able to educate patients. But as the followership grows, I think a lot of people end up outsourcing it to marketing brands who now take control of the platforms and go ahead with patient engagement. But for most hospitals, it's run by like a unit within the hospital that's in charge of their social media, their website, and all of that. So it's both ways, both personnel and marketing agents.
Yeah. Okay. And maybe when it comes from the hospital or the institution, maybe as you've shown, maybe it's more gives more credibility to for people to follow and to take the advice or anything like the vaccination, and I think it's very, very important. So do we have more questions? We can now go with the closing by Saseendar and then the webinar. Do some of the faculties do have questions for each other or to each other? Is it okay? Can move forward.
Yep, thank you. We need to understand positives and negatives of all that facilities that are available with us. It is good to know what we are dealing with in order to decide for ourselves whether we want to proceed with social media for marketing or patient education or networking. But not knowing ignorance is not a wonderful thing to be in. And everyone had a point to make. We need to be careful what we are doing with the social media, and it would best be the ideal thing to educate people rather than market for yourself in order to maintain the standards of the medical field and also not look like soliciting patients. Thank you so much. It was a great meeting. Thank you for making it and spending your time for us. Meet you again sometime later.
Okay. Thank you, everybody. It was a great webinar. Thank you for joining. Thank you for your help and your time and everything. Thank you so much.
Bye-bye,
everyone.
Bye.
Bye-bye.
Bye-bye.